Hiya guys. My name is Anna, and with me today is Dr. Michael.
Hello.
Do you mind if I ask you a few questions about a special disease called nerve deafness?
No, I don't mind. Please come to my office.
So doc, what is actually nerve deafness?
Nerve deafness is hearing loss or impairment resulting from injury or malfunction of the organ cordia or auditory nerve. This condition is referred to sensory neural hearing loss.
Alright, I get it now. However doc, could you explain more about the factor that cause this deafness?
Sure. Sensory neural hearing loss can be sorted into two categories.
The first one is acquired sensory neural hearing loss. Acquired means, hearing loss develops after the person is born, usually later in life. The causes can include aging. This type of loss occurs over time, typically in both ears. It's sometimes difficult to notice. Second is noise-induced hearing loss. This can be caused by exposure to a one-time loud noise, such as an explosion or gunfire, or from sound louder than 85 decibels over an extended period of time. Third is disease and infectious, like viral infectious, including measles, meningitis and mumps. Fourth is head or acoustic trauma. Damage in your inner ear also can be caused by a blow to the head or exposure to extremely loud noise such as an explosion. Next is tumors. Examples of common tumor that can affect hearing include acoustic neuroma and cholesteatoma. The last one is medications. Some cause permanent damage include certain types of antibiotics, anti-inflammatory medication and cancer chemotherapy drugs. Next, the second one is congenital sensory neural hearing loss. This happened during pregnancy. The causes are prematurity, maternal diabetes, genetic, lack of oxygen during birth, and infectious diseases passed from the mother to child in the womb.
Oh, I see. Thank you, doctor, for the explanation. Doctor, if you don't mind, can you give me the examples of real cases of people living with hearing loss?
Oh sure. You can look at the computer screen and read about the real stories from people living with hearing loss.
Oh, okay. Thank you, doctor. I will read it now. Next, doctor, may I know what are the signs and symptoms of SNHL?
Of course, Anna. I can give you a list of it. Some sounds would seem to be overly loud in one ear only. Have problem to keep up with the conversation when two or more people were talking. Other people's voices sound mumbled or slurred. Feeling being off balance or dizzy, and it is called as acoustic neuromas. Tinnitus, which is ringing or buzzing sound in your ears. Have problem with hearing high-pitched sounds.
Oh, thank you, doctor, for your enlightenment regarding the symptoms of SNHL.
No problem, Anna.
Next, may I know what are the appropriate intervention or medication to treat the disease?
Yes, of course. Recommended treatment to treat the disease. by using hearing aids. However, simply amplifying all sound won't help the patient's hearing get better because some sounds would still be distorted. That is why proper testing and fitting is vital. The hearing test will produce an audiogram. The graph illustrates the audiogram. That will help care professional pick the best hearing aid style. If hearing loss is severe or profound, cochlear implant would be the better option. Cochlear implant provides the sense of sound by stimulating the auditory nerve directly. Surgery is done to place the implant. Lastly, implant makes the sound become louder, but it does not restore the normal hearing.
Doctor, can you show me how the cochlear implant work?
Sure. I will show you the function from external and internal components. Before that, I want to introduce external components of cochlear implant, which consist of processor, microphone and transmitter, while the internal components consist of receiver and cochlea with implant electrode. Let's watch a video.
Sound travels to your ear and the sound processor, which sits behind the ear. The microphones on the sound processor pick up sounds, and the processor converts them into digital information. This information is transferred through the coil to the implant just under the skin. The implant sends digital sound signals down the electrode into the cochlea. The hearing nerve fibers in the cochlea pick up the signals and send them to the brain, which is translated as the sound you hear.
Great, doctor. Now, I know how its function. Doctor, who is the candidates for the cochlear implant?
The first candidate for the cochlear implant is the children. Children as young as 12 months may be eligible for a cochlear implant. Second is adults. Adults may qualify whether they lose their hearing before or after learning language. Also, for older adults, the average age of the cochlear implant recipient is 65.
Thank you, doctor, for your explanation regarding the nerve deafness. Thank you for watching.